While the nation sees the death toll and the number of coronavirus cases rise, President Trump remains focused on other things, including overturning the certified presidential election. Lawyers for the president filed a motion to join a Texas lawsuit asking the Supreme Court to invalidate millions of ballots across 4 battleground states, despite not having evidence of widespread voter fraud. A decision on that lawsuit could come as early as today. In addition to fighting the election results, President Trump is also ignoring CDC guidelines by hosting a potential super spreader event. He held a packed Hanukkah party at the White House last night, the same day the U.S. saw a record number of single-day coronavirus deaths. Meanwhile, another member of the president's inner circle reportedly received special treatment for the coronavirus. According to the New York Times, doctors gave Rudy Giuliani the same monoclonal antibody therapies as the president. Those treatments are not readily available, and hospitals across the country are being forced to ration them. Joining us now to talk more about this is John Moore, professor of microbiology and immunology at Weill Cornell Medical College. Dr. Moore, welcome. Great to have you with us. So is the United States seeing that Thanksgiving surge we were warned about, or have we not quite gotten there yet?
Well, we're certainly starting to see it, and we may not have reached the peak yet, and the peak will come as we intersect with the Christmas, Hanukkah, Kwanzaa period. I mean, it's just going to continue to increase. The infection rates are going to continue to increase. Unfortunately, that means the death rates are going to continue to increase. Hospitalizations nationwide are at an all-time record. This is a terrible time in American history, and it won't get any better for the next month or two, I'm afraid. It's really not a good situation for us all.
And we've seen, recently President Trump and members of his inner circle flouting CDC guidelines. They've been in public without masks, even saying coronavirus is a hoax. But yet, when they get sick, they're put in the hospital and given treatments not afforded to the average American. As cases rise at an alarming rate, what do you say to people who still have trouble understanding the severity and the reality of this pandemic and what it takes to control it?
Well, there's a complete deficit in national leadership on this issue. We deserve better as a people. We're clearly not getting the message from the top that we should be receiving. It's really down to us as individuals now. We have to receive and share the most appropriate guidance and information on how to behave in the face of a rapidly expanding pandemic. And there are some simple precautions we can all take, which includes what we should all know by now: social distancing, mask wearing, the application of sheer common sense, the necessity to avoid indoor dining, avoid large family gatherings. I mean, it is better to miss this Christmas and be around for the next one than to take serious risks in the coming holiday period and not be around the next year indefinitely, because people will die as a result of breaking down the social distancing guidelines. It's just, we have to be sensible about this and take short-term pain for long-term benefit. And yes,
and Doctor, tell us.
The situation.
Sorry, please finish.
Situation with access to generally unavailable therapies is another bad example. You mentioned the monoclonal antibody. I've checked with colleagues, and I'm not a physician, but I've checked with colleagues in the hospital today what this situation is about availability to monoclonal antibody therapies, and it's very limited availability. And it's not being used within the hospital as a standard of care. It's available to a subset of patients on an outpatient basis if they have the appropriate clinical profile, if they are at serious risk of developing severe COVID and death. They can get it sometimes. But nationwide, these drugs are not widely available. So people who can pull the strings and make the phone calls are unquestionably jumping a line that other people do not have the ability to do.
That should be more clear, because it sounds like, when we see these people in positions of power get coronavirus, they go into the hospital for a few days, they get these treatments that are not available to most people, and then they come out. The message seems to be, oh, you know what, it's not that bad. There should be a clearer understanding of the treatments that some people are getting because they are, let's face it, more powerful than the average American, and that's not available to everyone. Speaking of these antibody treatments, I know, as you said, that they're right now being allocated for, those who desperately need them, or, as we said, unfortunately, people who could pull the right strings. But is there any chance that they can be more widely distributed?
Well, they're still being evaluated. I mean, they've been authorized for emergency use, but one of them is on a clinical hold for inpatient treatment. But they're still experimental drugs, and they're only ever likely to be effective if given very soon after diagnosis. That's how they work, in the first week after a diagnosis. So they're not being used and shouldn't be used to treat late-stage COVID patients. They're not a resurrection factor. They're used under specialist circumstances, and there's still a lot to be learned about them. Plus, they're in short supply.
Right. All very important information to get out to the general public. Doctor, what kind of concerns do you believe still need to be addressed in rolling out a coronavirus vaccine and getting people immunized properly?
Well, we're all waiting for the outcome of the meeting that you said at the start of this program. You said is going on today at the FDA, and we're all fairly confident that the approval will come for first the Pfizer vaccine and then the Moderna vaccine in a week's time. And these are good and important developments. But it will take time to roll these vaccines out on a gradual basis to the American people. And this is not going to fully occur for the first several months of 2021. I mean, to get enough of the population immunized to make a real dent in the pandemic is going to take right through the spring and into the early summer at the earliest. So it's a gradual process, and the first people who will be immunized are those who most need it. Frontline healthcare workers, the most at-risk people of getting infection, subset of patients or subset of people who are at greatest risk of severe disease. And then there'll be a priority list, and the priority lists are still being worked out at national level and at state level, and then within institutions. So there's a lot still to be done, but the approvals that should come in the next week are seriously major steps forward.
A light at the end of the tunnel. Well, Dr. John Moore, thank you so much for joining us. We appreciate it.
Thank you.